Hi, everyone. Welcome back. I'm Dr. Samantha, the maternity mentor, and we're here for another one of our live Q&A sessions that we have every Monday at 9 p.m. Eastern Standard Time. This is my chance to interact with you guys and your chance to interact with me, and it's one of my favorite things that I like to do as a practitioner. Remember, you can also catch us over on Facebook, Instagram, and Twitter for additional content. We will link those into the description. Please like and subscribe to the channel. Subscribing is really important for content creators. And for those of you who aren't aware, we were just actually approved to be part of the YouTube Health platform. And part of that is to be a channel that is being actively looked at and followed. And it does include members of the health community like myself who've been vetted so that you guys know we're providing accurate quality health information. So please let us know, in comments and stuff, what topics you want to hear more about. We've got some exciting videos coming up. For those of you who stick around until the end, I'm going to go ahead and give you a sneak peek at tomorrow's video. For those of you who are joining me live, please remember, you can go ahead and you can put questions into the chat and I will answer those as well as questions you guys have submitted onto the videos this week. So we actually have one in the chat, which is awesome. So hi, Jade. The question is, how much does it increase a person's risk of birth defects if Bactrim was taken prior to pregnancy and during 3 to 5 weeks of pregnancy, along with levofloxacin taken right before pregnancy? So Bactrim and levofloxacin are antibiotics. So these are medications that are used to treat infections, specifically bacterial infections. And we get a lot of questions about antibiotics because with pregnant women, you're considered immunocompromised. That means your immune system is not working well. The reason why a woman is immunocompromised in its simplest form is because if your body was working at full capacity, it might think the baby is a foreign invader and would maybe potentially try to attack the baby in the early stages. So our bodies are kind of designed to be calmed down in the immune system category. So we're much more prone to infection. That's why they're very big on vaccinating pregnant women, because you are at a much higher risk for serious infection and hospitalization due to certain diseases. So when it comes to antibiotics, most infections that you need an antibiotic for if the infection is not treated, it puts you at risk for preterm birth, stillbirth, miscarriage, etc. So you want to make sure it gets treated. Now, when you take an antibiotic, it's important to make sure you take all of it as prescribed, because otherwise this leads to antibiotic resistance. And this means that the bacteria won't be killed off by the medication we're giving you. And then we need to use stronger medications. So this is why it's so important when you are prescribed a medication, you need to take it. However, there are certain meds that are not as safe during pregnancy. And so this is why it's so important. And for those of you who know women who are of childbearing age, friends, family, coworkers, you should be telling everybody, and I think this is very important, if you're about to receive a medication, you want to ask them if it is safe for pregnancy, even if you are not planning on getting pregnant, but there's a possibility you could, because you want to make sure whatever's going into your body is going to be safe in case an accidental pregnancy occurs, which can happen. So in the case of Bactrim, Bactrim is not something that we recommend prior to pregnancy or during the first couple weeks of pregnancy. There's not a lot of data on any medications because we cannot do studies on pregnant women. It's not ethical. So all we can do is collect data after people have used some of these medications and seen what the outcomes are. It appears that Bactrim has been associated with a higher chance of cleft lip and cleft palate, and there may be some issues with your ability to process folic acid when you've been taking Bactrim right before pregnancy or during the first couple weeks. Folic acid is the vitamin that you need to prevent neural tube defects such as spina bifida. And that's basically where parts of the spinal cord are out open to the air. Like they don't form closed like we normally see. So Bactrim is not recommended for that reason. Now, Levofloxacin, there is less data. We are not 100% sure. It's a newer drug. The class of drugs, fluoroquinolones, which is what that's a part of, in general is not recommended. However, there's not a lot of data to say that it would cause an issue, and animal studies are inconclusive specifically on levofloxacin. But we do know that levofloxacin in an adult can cause musculoskeletal issues, including the rupture of tendons. Tendons are like soft pieces of tissue that connect bones and tissue together. So since we know that could happen in an adult, in theory, there could be an issue with a baby. So generally speaking, levofloxacin is not recommended during the first trimester or right before pregnancy if we can help it. However, that one definitely is a risk versus benefits. Now, risk. So everybody uses that word. When you're pregnant and something isn't going exactly as you planned, you get very anxious. That's a very, very normal reaction. And one of the things that can happen is you start to get some intrusive thoughts and you're playing the what if game. What if this? What if that? What is, my odds? Like, how can I figure out where I'm at? Okay. So the thing is, there's no way to answer that question. There are a few things where we can say definitively, this is going to cause an issue but that is a very rare thing. It's one of those things that you cannot undo. So I would focus less on the risk because we can't undo it, right? And more on getting with your OBGYN and asking them to get you to a maternal fetal medicine physician. So one of the things I do is I'm in psychiatry, and I will get women who come to me who have found out they're pregnant and they're on medications we don't want them to take while they're pregnant, okay? A great example is lithium, okay? Lithium can cause some birth defects. So one of the things that I do is I get women off of those meds and either onto other meds or no meds as part of trying to get things to the best place we can be medically for mom and for baby. Now, all those women, I tell them you need to go to maternal fetal medicine. I write a letter to the OBs send them over. Maternal fetal medicine physicians are the physicians that handle high-risk pregnancies or any complications of pregnancies. If you can tell an OB that your referral needs to be because you took a medication in your first trimester that may have not been recommended for pregnancy, that should be enough for you to be able to get a referral to a maternal fetal medicine doctor. Why go there? One of the things that they do is they will do very, very specialized ultrasounds in their office. Now, the ultrasound you get at your OB's office is great. The ultrasound you might get in a hospital or an outpatient center, they're good and they're well read. But maternal fetal medicine doctors, they're doing these ultrasounds every single day in and day out, looking for these fine, minute details that, generally speaking, may or may not be picked up on every regular standard ultrasound. So they're the guys to check something like this out to see if the baby has any kind of birth defects or anything like that. They can also talk to you more about putting together the picture of your whole kind of situation at that moment. For example, if you were taking a prenatal vitamin, an extra folic acid, and you lived like this great healthy lifestyle, you were perfect BMI and all this other stuff, maybe the risk is not that big of a deal. It's probably also dependent on when you took the Bactrim and how long you took the Bactrim for and what were you taking the Bactrim for. You could take Bactrim eye drops. That's a completely different story. So this is why a maternal fetal medicine can kind of answer that. Hi, Corius. Can your tubes grow back after a piece has been removed? Can you possibly get pregnant again? So this is a great question, and actually it's very common. It's very commonly asked. So she's talking about the fallopian tubes. So you have the uterus, okay? This is where your baby's going to live in your belly. Now, coming up from the uterus, you have the two fallopian tubes that go to the ovaries. This is where the eggs are. The eggs get released. They go into the fallopian tubes. Now, the ovary and the fallopian tube, they aren't connected to each other. This is actually like floating out here. There is a little teeny tiny gap between the two. But at the end of the fallopian tube, there's like these fingers, like these kind of things, like tentacles almost, I guess I would say. and they kind of grab the egg and bring it down into the fallopian tube every time you ovulate. Now, when we go ahead and do a tubal ligation, which is where we're removing the tubes, what we actually do is we cut off the back end and basically tie a knot near the uterus. Okay. So it's like there's a piece of tissue that comes out when you're in the operating room. I've seen them. We put them into little cups and we always actually send them off for a biopsy, because whenever we remove something from the body, we want to make sure there's nothing else going on with it. So it's kind of standard procedure. So it's a piece of tissue. It's gone. Now, there used to be, back in the day, 20, 30 years ago, where they did the procedure a little bit differently and they burned the ends. And so it was very common for pieces to get back together it's called reanatomized, something like that. It basically means they connect back together, right? And then women would get pregnant again. There was also a time where you could go back and have it reversed. Same idea. They had left two pieces, so they would basically just put them together, get rid of the thing. They don't do that anymore. And I'm not going to say it's impossible, but there's really no tissue left. It's all gone. So I have taken care of some women who have had a tubal ligation and decided to get pregnant after that. It's usually IVF. So your ovaries are still there. So you still have eggs. You're still hormonally like normal. You don't go through menopause unless the ovaries are actually removed. So what a lot of women do is they go through a cycle of IVF, they retrieve eggs, and then they do an IUI, which is an intrauterine insemination, where they put in an egg and a sperm together. That's one of the ways that they do it. So the answer is kind of no, unfortunately. But getting pregnant again, yes, just with outside intervention. Are IVFs effective, and are they even affordable? So effective, yes. Complicated, absolutely. Affordable, kind of, sort of, sometimes. Other times, like, no, not at all. It really depends. A lot of insurance companies now, health insurance companies, are covering parts of IVF. Okay. So if you have health insurance coverage, a lot of times you can get 2 or 3 rounds of IVF at a reasonable cost. And I'm going to say reasonable because sometimes it is still like $10,000, but a whole IVF cycle without any insurance can be $100,000 or more. Okay. So can it work? Can it work fast? Yes. Now, complicated. Oh my gosh. Yes. Complicated. I really think, unfortunately, IVF, and I actually think I want to do some videos on it. I don't think people are told kind of upfront what IVF looks like. And a lot of times people sign packages to be with a certain IVF company, which then pigeonholes them into that company. And if they're not liking their care midway through, they can't really switch because of insurance. It's like a thing. So in the case of no fallopian tubes, okay, you decide to get your tubes tied, and then all of a sudden, 10 years later, you want to have a baby. No fertility issues for you, no fertility issues for the partner, then it could be pretty quick and standard. Take some hormones, get some eggs, get them fertilized, get them in, you get pregnant, and it's done. For other people, there are labs sometimes every single week, ultrasounds every single week, a special diet, which means you're meeting with a nutritionist. Sometimes they have you meeting with like physical therapists, etc. If you don't follow the diet, they won't go through an IVF cycle. A lot of times they're having you take a lot of expensive vitamins that you can't get anywhere else. That doesn't count prescription medications that they may prescribe to you that may or may not be covered by your insurance, even if the IVF procedure itself is. So complicated. And then they can only do certain things based off of your cycle. So like if you need to do a certain test 5 days after the first day of your period, and that 5th day happens to fall on a Saturday when your best friend is getting married in New Mexico, you have to drop everything and get to the IVF doctor, or you miss that entire month. So this is why I say it can be complicated. It really is very personalized. It's very amazing but it is something that is a process, which is why for those of you who have friends or family who've gone through IVF, please give them lots of compassion and support, because it's a lot. It is a lot that a family goes through to have that baby. Hi, Renee. My 6 weeks pregnant and I'm cramping and I had some spotting. Is it normal? So I'm sorry to hear that, Renee. So I'm going to tell you a little bit more. We get a lot of questions on this. I can't say for sure that it's normal, Renee. And anybody who has this, I am always telling them, call your OBGYN or go to the hospital. Here's why. So it could be normal. There's a lot of normal reasons to potentially bleed in the first trimester. And I get so many questions. That usually is what I start out with. So right after this, I'll peek and see what else I got for bleeding this week. During the first trimester, there's a lot going on in the uterus as it tries to get ready for what's about to happen. The hormones for sustaining a healthy pregnancy will thin out the vaginal tissue. That's number one. So if you've had sex or anything, that could cause bleeding on its own. That could cause spotting because the vaginal tissue is thin and it will tear easily. And so you could get some spotting. You can also get spotting from implantation bleeding. So implantation bleeding is when the fertilized egg comes down and attaches to the uterine wall. Then there can be a little bit of bleeding that happens as a result of that. Now, that shouldn't happen at 6 weeks, but a lot of people don't take this as an insult to anybody, but a lot of people don't actually know how far along they are. They think they do and they don't. So that really can actually impact whether you're having implantation bleeding or not. Also, no matter what the book says, okay, the baby does have to get attached to the uterine wall within a certain amount of time, but it's not exactly according to every textbook you've ever read. Then it could be your normal period. So believe it or not, if you think about it, you could have that baby implant at 2 weeks, and now your body's kind of like, wait, what? And so 4 weeks later, it's trying to kick into a menstrual cycle, and it doesn't really happen because you're not really supposed to be having a menstrual cycle. So you get a little bit of spotting and nothing else. So that's also something that could be happening. And then another thing, and I'm going to read this question that I had is from a viewer who said, I have been bleeding for a long time. We've done scanning and it's showing a subchorionic hemorrhage, 119.1 cc's. Is that high? So a subchorionic hemorrhage is another reason why you could be bleeding. So a subchorionic hemorrhage is, so you have your placenta, right? And it attaches to the uterine wall. This side of the placenta is all blood vessels. And this side of your uterine wall is going to basically open up and be all blood vessels. And the two together create this bed where it exchanges all that blood and nutrients and stuff for the baby, right? Okay. So this is all blood vessels. And just like anything else, a blood vessel could burst or break and create like a little puddle underneath there. That's a subchorionic hemorrhage. Kind of like if you get a bruise underneath your skin, like if you pop a blood vessel here, the blood bleeds out into like a little area. And then over time it shrinks and then it's gone again. That's what subchorionic hemorrhages do. So you'll get this burst of blood, and sometimes a little bit of that will leak out, and that's what you see as spotting. Now, when your placenta is small and the subchorionic hemorrhage, so if this is like a placenta and this is the subchorionic hemorrhage, right? That's big for this small placenta. But as your pregnancy grows, the placenta gets bigger as well. And now, if you have that same subchorionic hemorrhage, it's much smaller. So the other thing is when this person gave their measurements, that measurement is very dependent on how far along you are in the pregnancy. And the further you get along, the smaller and smaller that hemorrhage can be, and it can go away. Back to you, Renee. The reason why you do need to get checked out is because certain things we can help with. And so, for example, they can do an ultrasound and they can see, do they see a subchorionic hemorrhage? Do they see the sac for the baby? What do they see? But one of the other causes, very common causes of spotting, is infection. Guys, infection is the number one cause of preterm labor and miscarriage. Like number one, so many times. I cannot tell you all different types of infections, things that seem so mild, but in a pregnant woman can be so significant. So when you go, they're going to swab you. They're going to take a sterile swab and they're going to swab inside the vagina and they're going to collect discharge. And they can send that off and they can test it. If they find ureaplasma, mycoplasma, yeast, all this other stuff, like we can treat that. If you have a urinary tract infection, that can cause bleeding as well. So it's like one of those things that you want to make sure that you like have this checked out, okay? And don't feel stupid like you're pregnant. It's okay. Like they see it all the time and it's just very important to get checked out. And then the last thing that I'm going to say that I feel very strongly about, and I apologize, Renee, but I am going to just say something because I can see like a profile picture. So if that is you, you are a woman of color, you need to make sure that you ask them to do all the tests to make sure that you do not have an infection and you do not let them dismiss you because they say, oh, you're 6 weeks, there's nothing we can do. You have the right to get every bit of testing that every other person can get. And unfortunately, here in the US, as well as in other Western countries in the world, we are now fully aware that Black women are not getting the same level of care as other women are. And it is unfortunately killing them. So I am a very big advocate that you need to very much respectfully but loudly ask for them to make sure they've checked you out, okay? Because it is very important and it's something I'm very passionate about. Hi, Emma. So is there a way to find out the blood type of my baby before it's born? I am Rh negative and my partner is Rh positive. So it would be reassuring to know if my baby has my blood type. So as of right now, I am not aware of a way to get your baby's blood type beforehand. I would tell you though, knowing what I know about how fast the science is advancing, it's possible it's going to be there, but I haven't heard of that technology actually coming about, not even in like genetic testing. I don't know why. I'd be curious to know why you think it would be reassuring if you're worried about the RH sensitivity. Like they're just going to give you the RhoGAM shot at 28 weeks. That's approximately when they give it. And we have a video on RhoGAM if you want more information. And then what they do again is once the baby is born, they're going to test the baby's blood type. And if baby is positive, they'll give you another shot. So, you know, that's pretty much it. But other than the positive, negative, because we know of the technology for RhoGAM and stuff, it's not usually something that really makes much of a difference. It's just important that you get that RhoGAM shot until we know. But yeah, let me know, add more to it if you're like, what makes you nervous about not knowing what the baby's blood type is? Because it's very common for women to have babies that don't have the same blood type all the time. You're welcome, Renee. I really hope it helped. So we had like, we always have questions on bleeding. And I'm going to kind of go a little bit on this question as well, since we just talked about it. I've been bleeding heavy and cramping as if I was on my menstrual period for 4 days now. I'm 8 weeks pregnant. The doctor ordered blood work and the HCG was higher at 2365. I don't see her again for 2 weeks. And in the meantime, I'm a mess not knowing if I'm miscarrying. So this is another reason to go and get checked out when you're bleeding. So HCG, human chorionic gonadotropin. It's the measurement of a hormone in our blood to see if we're pregnant. It is also the same thing that we test when you pee on the stick for the home pregnancy test. That's what they're testing for, is HCG. Now, when you get a singular blood HCG level, it means nothing. It really doesn't mean much, because there are definitely times where we know the HCG level should be a certain amount, but that's still just a guideline. So what truly tells us whether you're having a miscarriage or not is serial HCG levels. What does that mean? That means you get your blood drawn today, You get your HCG level, and 2 to 3 days later, it is drawn again. If it moves higher, that is usually a good sign that the pregnancy is progressing normally. If it goes lower, that usually is a sign of a miscarriage. So it's very important for us to get this data to help guide your care. Because if you're having a miscarriage, your HCG levels are dropping, we can no longer see a viable pregnancy via ultrasound, but you continue to bleed, that can become a medical emergency. Sometimes we are not able to naturally pass the baby, and as a result, you need to have a procedure called a DNC. This is where we dilate the cervix and we curettage or scrape the uterine wall to get out all of the products because they got embedded in and they could not come out. So this is why it's important to know what's happening. And getting a singular HCG level does not tell you what's happening. Now, the other unfortunate thing is if you are having a miscarriage, you can still pee on a pregnancy test and pee positive, because even if your baby has passed, you still have HCG in your system. So I also need you guys to understand that in the case of miscarriage, peeing on a stick does not help. So when you're going to get checked out, if they're going to do your pregnancy HCG blood test, ask when you can come back to get a second one to determine what's going on. And that's pretty standard of care. For those who are joining me, hi, I'm Dr. Samantha, the maternity mentor. Welcome, welcome. Please feel free to put your questions into the chat. I'm just answering some of the questions that we've gotten on some of the from some of our viewers, as well as on the videos this week. So I had several questions on drying up breast milk. And I really liked these questions. They were very good. And I think it's a very important topic. I am a lactation consultant. I've been a lactation consultant for over a decade now, but I'm very pro formula. Breastfeeding is not for everybody. Breastfeeding is not the end all be all of everything, right? So I think it's very important for you guys to realize that you can do this more than one way. And so sometimes if you can't breastfeed for whatever reason, you need to dry up your milk. So I had a question that said, I am suffering from too much milk even after taking cabergoline. And another one said, I was put on the depot shot to stop bleeding from my miscarriage 6 years ago. I'm still lactating and I can easily induce more. I just want to get to the point where I can either safely donate it or have it just go away. And another one said, hi, doctor, I'm a new mom and I don't want to breastfeed my baby. How can I stop breastfeeding? Can you prescribe medicine to stop breastfeeding? Okay, so these mention a couple different medications that are involved with hormones and stopping the production of breast milk. So prolactin is the hormone that tells our body to make milk, right? It's the quantity, the milk quantity hormone. And as long as your prolactin levels are high, you will continue to produce milk. Now, they can remain high if you're stimulating the breast to make milk. They can also remain high for other reasons, including stress and including something called a prolactinoma, which is actually a tumor that can occur. It's benign, but it needs to be taken care of. So for somebody who received Depo and is still, producing milk 6 years later, that's not normal. You need to go actually to your primary care physician. You need to have them refer you to a endocrinologist who's probably going to order an MRI to see if you have a prolactinoma, which is that tumor. If you have that tumor, it sounds super scary. Yes, anything like that is scary, but it is a benign tumor. It's not cancerous, but it will need to be removed. But after 6 years, you shouldn't be able to make that much milk. For those of you who don't know, Depo-Provera is a shot that is given for birth control. So a lot of times the birth control meds, they have too much estrogen in them and they will calm down your milk supply. So that's why that was given to that person and it didn't work. Cabergoline. Cabergoline is absolutely one of the most terrible medications ever. I wish they didn't give it to people. I think it's terrible. And so let me explain. Cabergoline is a medication that it basically stops prolactin, which is awesome. So it works usually really well to stop your breast milk supply. So the thing is, it also boosts your mood. Okay, so it actually makes you feel really good. But you can only take cabergoline, I think it's 10 days. It's 10 days or 2 weeks. It's a very short period of time. When you are done and they stop the cabergoline, your mood drops immediately. And what can result is a rebound, severe postpartum depression. It is well known that when cabergoline comes off, depression is very common. And when you are a postpartum woman who is trying to dry up your milk and then you have a rebound depression, that can be catastrophic. So I think cabergoline is terrible. I do not think it should be offered to women. I think there's so many other ways that we can dry up your milk. And the very few exceptions that I've ever seen have to do with like a traumatic miscarriage. And even then, it usually ends up just being a disaster. Now, if you've taken cabergoline and you are still lactating, you need to see an endocrinologist to be checked out to see if you have a prolactinoma. Okay. It is very uncommon after the use of cabergoline that you will have any breast milk left. So finally, we have the question of, okay, what do? I want to stop. So one of the things I would ask is ask your doctor if you're eligible to take Benadryl or Sudafed or Claritin or Zyrtec. All of those medications that are used for allergies, those medications are actually also really good at drying up your milk supply. Because if you think about it, you're drying up, so it's going to dry you up, right? So all of those are like fantastic for that. Peppermint is a big thing that will dry up your milk supply. And so actually, I've started telling people to get peppermint oil deodorant, like real peppermint oil deodorant. Like you have to go to like a fancy like organic store to get it. But I actually had a patient who we could not figure out for the life of us what had tanked her milk supply. That's what it was. And it actually works really, really well. And so I will tell you peppermint oil deodorant is another one. There's, cabbage leaves and there's different herbs. We have a video on herbs that you can take, all different stuff. But ultimately, you definitely want to get checked out if it's been years and you're still producing breast milk. Is it common to have period symptoms but no period? I'm going to ask a rebuttal question. Do you mean during pregnancy? So I'll wait for your reply while I answer another question. I had a question on water for formula. So I am very pro formula, even though I'm a lactation consultant. So it said, I need help with my baby. While watching your video, I noticed that you said you worked in the NICU. I have. My baby was born at 36 weeks. He's a preemie. I was told to use sterile water to make his formula, but like you mentioned, boiling doesn't really make it safe. So I was wondering if I can use distilled water from Parents' Choice. He's 1 month and 2 weeks old. And do I still need to boil the distilled water? So I think that it's really important that we advocate for parents who are using formula just as much as we advocate for parents who are choosing to offer breast milk. I think this is very key. This is why I put out this video. Now, I did used to work in the NICU. I've worked in all areas of this. So in the NICU, you have a variety of babies, and some of them are considered medically fragile. Now, usually these are the traditional preemies that you think of, these babies born at 25 weeks, 26 weeks, they're like 1 pound, you see the pictures online. There could be babies who are born with medical complications that we knew about up front. And then there's other preemies that are bigger preemies like this viewer. So 36 weeks. That is, just so y'all know, a preemie. That is not a full-term baby. Your baby is not full-term until 40 weeks. Now, in my experience in the NICU, unless it was a baby that was medically fragile, we usually did not tell parents to go home with strict guidelines on like boiling water, except if we knew they lived in a neighborhood with poor water quality. So every place around the world has it. You know where you live, you know the access to water you have. I'm in South Florida, and for example, on Miami Beach, it floods a lot, right? It floods all the time. And so the water supply can become corrupted because of that. And so if you were taking care of any newborn on Miami Beach during a flooding situation, you wouldn't want a parent who thinks the tap water is just fine to be just grabbing and going and not realizing that they were just about to put a boil water notice out. Okay. So that's like a very good example of one of a million things that could happen. Now, if your baby has some medical issue that I'm not aware of, you should follow those guidelines. But generally speaking, you don't boil distilled water. There's no reason for it. If the baby's now a month and 2 days, so that baby's now basically adjusted to 42 weeks, there's no reason if the baby's having medical issues. I would go to your pediatrician at this point and say, hey, I would like to switch over to this. My guess is the pediatrician hasn't even thought about it because they probably just assumed you were going to switch over, and or they have thought about it. They still want you to do it, but they haven't given you enough information for you to understand why, because I don't understand why. But distilled water does not need to be boiled. So I'm not sure what they're looking at. So definitely check with a pediatrician, but I don't think you should have to, unless you live in an area where your water supply is at risk. No pregnancy test, but I've had a ligation. Oh yeah, you could still have period symptoms and no period with a ligation. It's not common, but yeah, that is possible that you could have that. Your a ligation, you still got like all the other stuff in place. So yeah, you probably could, but I would get that checked out, Coria, because you should also be getting the period as well, unless the uterus is gone. All right. So, sex. I have videos out on sex and pregnancy because I feel I think this is a subject that we don't talk a lot about. I think a lot of people get embarrassed, and I think it's something that we should have a good discussion on. So this question was, I'm in my second trimester and I'm dry no matter how much my partner stimulates me. So congratulations. This probably means your pregnancy is going fairly well. So unfortunately, very unfortunately, the hormones that help keep a healthy pregnancy can make the vagina super dry. And this is just very common. It's very, very, very normal. And it sucks sometimes even more because in the second trimester, some women will start to get a libido that's very strong. And so then they want to like have sex and they can't because it's like very painful for them. When you are pregnant or when you are postpartum, I suggest you invest in a couple things. Number one, a couple sets of sheets. Number two, maybe a couple towels. And number three, a lot of lube, a lot of lubricating jelly, guys. We don't like to use it because it's like messy and then you got to clean up afterwards. But trust me, it's going to be worth every single bit of it. Sex is very healthy. It's very normal. It keeps you connected with your partner. It has a lot of good hormonal aspects to it. Unless you've been told you can't have sex, sex actually releases oxytocin, which is a very, very female hormone. It's part of pregnancy. It's part of labor. It's like a really good thing. So, but you can't have sex if it's hurting. So that's why you need to use lubrication. And so this is one of the things that I think is very important. But what I do want you guys to know is that it's normal. Okay. It is normal to be dry. Now, the other thing is some people choose to have sex when they are not in the right headspace. So women are far more affected by what's going on inside our head when it comes to sex than men tend to be. If we start thinking about the chores or a fight we had with our mom or something like that, that can really interfere with our ability to be engaged and therefore get stimulated. So just understand if that is also what's happening, try to have a conversation with your partner, because then it's not really something the partner's doing. It's more about what your headspace is, and see about if that can be navigated or helped. How do you get moist naturally? So getting moist naturally, very much, it's obviously it makes a difference on whether you're there, you're in the moment, you're happy, you're ready to go, like you're there. That's one thing. It makes a difference on how you're physically feeling. Are you in pain? Are you tired? Are you hungry? Those things are also important. Okay. But your hormones are one of the most important pieces to actual natural lubrication. If your hormones are not quite in balance, then you may not naturally lubricate. And so that's one thing. But I do want to say, like, I think your question is very valid. Like with lube, like you're asking, like, is lube the only option, or is there a natural way? Well, lube is the only other option that there is. I would not, I repeat, do not start using some other crazy stuff that you hear people say. Don't go using coconut oil or olive oil or, some lotion or some organic something. Just so you ladies know, the microbiome of our vagina is extremely important, and it needs to maintain balance. And things that sound natural and good for you and could be good for you in a variety of other parts of your body are not good for the vagina. Coconut oil is a great example. Coconut oil is fantastic. It is one of the best things out there. It can be used as a natural nipple cream. It's one of the few things other than lanolin cream that I ever recommend. I mean, coconut oil is great, okay? The problem is coconut oil has a little bit of sugar in it naturally. And sugar in a vagina can allow for the natural yeast that's in your vagina to start to grow and expand. And then you have this huge yeast infection. Okay. And I can then give you examples of a million different natural things that can cause that. So this is why the lubricating jelly, like that man-made stuff that you see on the over the counter, like on the store, that's what you need to get, because it's made for this. And so it really usually will not cause any kind of vaginal irritation or vaginal infections. All right. So I had a couple questions on second trimester bleeding. One of them was also about a subchorionic hemorrhage. And she said that she was 21 weeks pregnant with a subchorionic hemorrhage, and her subchorionic hemorrhage has gotten bigger. Her doctor suspects it's turning into a placental abruption. She's been bleeding. She has low amniotic fluid, and the baby is measuring 8 days behind. I have no idea what will happen from here, or if there's still a good outcome for this sweet little baby. And I am so sorry to hear about this, because this is a very, very scary situation. So this is why you guys always need to make sure that you are following up with your care. If you have anything that is happening, you need to get checked out. So a placental abruption. So a subchorionic hemorrhage is like a little pool of blood under the placenta. A placental abruption is where the placenta comes off. So an abruption means it's happening before you've delivered, because of course, once you deliver the baby, the placenta is supposed to detach. But an abruption ahead of the placenta coming off ahead of time, that's an abruption, right? When the placenta starts to fail, an abruption can occur. Okay. So what do I mean by fail? Sometimes what will happen is when the baby comes out and we get the placenta, we can look at the other side of the placenta where all those open vessels are. And a lot of them will be like very squishy and moist, and it looks like hamburger, and you can see the vessels, and it's just a very deep red, and it looks nice. And other placentas will be small and shriveled. They may have calcifications, which are actual like like little white areas that are just completely dead. It can be very shriveled. You might not be able to see any vessels at all because everything was just kind of getting yucky. Okay. That is a placenta that's failing. When that happens, if the placenta is not functioning right, then the baby is not getting enough nutrients through the cord in order to grow properly and do all the development that needs to happen. Now, one of the things that can happen is when there are certain birth defects present, those birth defects can release certain chemicals basically into the amniotic fluid and into your bloodstream that signals to the body that something's going wrong. And then your body will sometimes start to try to induce a miscarriage, thinking that this is not going to be a viable pregnancy. I know this is very hard, but this is what happens. Now, we have a lot of modern day medicine that allows for us to do a lot of things if we can see stuff soon enough in advance. One of the things that's happening with this viewer is that she needs to get to viability. So right now, we cannot really save a baby who is less than 22 weeks along. Okay. Babies under 22 weeks along just haven't had enough time to develop. You will hear every once in a while about the miracle story, but generally speaking, it's a very hard thing. So we try to get you to 22 weeks. Ideally, obviously longer, 24 weeks was really the standard for the longest time. And so at the young end, 24 weeks would be like fantastic, but usually 22 weeks now. So until we get to that point, there's not much we can do other than to have you rest, take care of yourself, stuff like that. If you haven't, if this viewer's on, if you haven't had a chance to talk with your doctor, I'd be asking to see a maternal fetal medicine. Honestly, I'd be asking if you can be admitted into a hospital. Part of my career was taking care of pregnant women who were in the hospital for a variety of complications, including preterm labor. So this is one other thing that potentially could, help out the situation if you could be on continuous monitoring and stuff. So, but unfortunately, there's no way to know what the outcome could be. A lot of women will have some serious complications and then just ride it out up until the very end. So I wish I could tell you more. I had another patient say, it's my first time being pregnant and I don't know what to expect. I'm 13 weeks pregnant and I just hit my second trimester and I'm having light bleeding. I was told that I have a right ovarian cyst at 8 weeks. My appointment isn't until the end of the month, but I'm starting to worry because I feel a weight on my bladder and it's hard for me to sit up sometimes and stay in that position. Should I be worried or should I just let it pass? Guys, don't worry. Don't just let it pass. Just call a doctor. Okay? That's what I need to say. If you cannot sit in a position you would normally sit in, that is a warning sign you need to call. Ovarian cysts can grow massively huge during pregnancy because they like the hormones that are surging through your ovaries because you're pregnant. So ovarian cyst that popped up at 8 weeks might be giant at 12 weeks. And you can only figure that out with an ultrasound. So make sure if you don't feel right, make sure you're getting it checked out. Because if you have this huge weight and something's kind of shifting, you might end up with like some serious issues. And if you're bleeding, that's not a good thing. We had a question on the antibiotic video, and it said, I was taking Livolin during the week of me getting pregnant. Should I continue taking it or should I stop because of me getting pregnant? Whenever I take it, I feel stomach pain. Okay. So specific to this medication, Livolin is not used where I practice, and therefore I cannot comment on this specifically. So what do you do if you're not sure and you need to find out? You can call your local pharmacist. So pharmacists have specialized training in medication, and they know what's safe for a pregnant woman or a woman who is breastfeeding. So if you're not sure about the advice you're getting, you can always talk to a pharmacist who can give you more guidance. You can also go back to your healthcare provider and ask for risks versus benefits. I will tell you that if you are having pain when you are taking a medication and you are pregnant, you need to call your doctor and find out what you should do. Because if you're having stomach pain and it's causing uterine contractions, well, that would be a bad thing. So I don't know enough about that specific medication, but it's definitely something I would be talking to your healthcare provider about. We're getting close to the end. I've got a couple more questions, but if you guys have questions, please put them into the chat. I had a question on premature birth video, and it said, I am in the hospital and my cervix is measuring 3.5 centimeters. They sent me to bed. Is that okay? All right. So, cervix. Okay, you got your uterus, and at the bottom is your cervix. This is where the baby's going to come out. And a cervix should be long, thick, and closed. Okay. And figures actually represent a cervix pretty good, because you see how you've got this little space in between? Well, your cervix has to be able to open, right? Dilate. So that cervix has a little opening like that. That's actually the space where the mucus plug is. So when you start to dilate and that mucus plug comes out, that's where it was. Okay. So dilation, right? So you have to get to 10 centimeters, right? It's like this large area. But 3.5 centimeters is potentially not a lot. Okay. I know it sounds like a lot, but actually, women who are on their third and fourth pregnancy can sometimes walk around at 3 centimeters for like 3 or 4 weeks, like it's nothing. So 3 centimeters is more important if you're actively contracting and having symptoms. When you're 0 centimeters, 3 centimeters sounds amazing. When you've been in labor for 12 centimeters and you're 3 centimeters, you are like so upset. And really, you could be, for the first 6 centimeters can take 18 hours sometimes. I mean, it can take a long time. So if you are relatively close to where you're going to deliver, the hospital, the midwife center, wherever, if you are, I would say, past 30 weeks, 32 weeks pregnant, and you're not actively contracting, you have no infection, nothing like that, yeah, it seems pretty reasonable to me. The hospitals are full of sick people. You go into the hospital, we could make you sick. I mean, that's just the truth of it, right? And then why, build up a bill if the baby's healthy, if everything's good? Like, there's no reason for it. Now, if you were 22 weeks pregnant and 3.5 centimeters, no, you should be admitted to the hospital, because you could literally deliver that baby at 5 centimeters. So it really depends on what's going on. I would tell you to watch my bed rest video, because there are some risks associated with bed rest. So you want to make sure that you understand. And there are also some questions that you should be asking, like, what does bed rest mean? Sometimes bed rest means you are not getting out of bed. Sometimes bed rest means that you can get up and go to the bathroom all the time. Sometimes bed rest means you're not allowed to take a shower and you have to be in bed 20 hours a day. I mean, you need to ask those questions. Okay. The last question we got was it was more like it was a question/comment. It said, I had a miscarriage on December 25th. I was 2.5 months pregnant, and I took a pill to remove the remnants of the pregnancy under the guidance of my doctor. I had irregular spotting until my next period, which was 10 days ago on January 22nd. The problem is I'm still bleeding after 10 days of my period. What should I do? So in this case, you need to go back to the doctor and you need to get checked out. So I have taken care of a lot of women who have had miscarriages, and they have required, additional medical assistance afterwards. Unfortunately, not all the time does a miscarriage just happen. For a variety of reasons, we will sometimes end up with extra remnants of the pregnancy embedded into the uterine tissue, and it requires a surgical procedure called a DNC. You have to go into the hospital, you have to get anesthesia, and then they scrape out the uterine wall. So if you've taken that pill and it hasn't worked and you're still bleeding, you need to call them so they can do an ultrasound and they can check you out. So that is the end of all of my questions. I am Dr. Samantha, the maternity mentor. Thank you so much for sticking around, those of you that did. I am very, very excited to see all of you guys. We're here every Monday at 9 p.m. Eastern Standard Time to answer your questions live, as well as answer any questions you guys might have submitted onto the videos. We read those comments. I answer a lot of those comments. So when you're putting stuff there, I am seeing it. Okay. And so you can put suggestions down. A lot of our videos have been based off of suggestions or comments here or other places. So tomorrow's video is actually going to be on post epidural spinal headaches. Very common complication after you've had an epidural. We always hear about back pain, but we don't really talk about the headache and what you can do about it. So that's going to be tomorrow's video. I hope you check it out. Please share the channel with your friends and family. Anybody who wants to know about that or other things, we've got a lot of exciting content up there. Please send them to the channel. Please like and subscribe. Subscribing really, really helps me out as a content creator. I really appreciate that. You have no idea how helpful it is to me. Hit the notification bell so you, my viewers, can be notified when I have content coming out onto the channel. We are now approved for YouTube Health. This is something very exciting. This is an area of the YouTube platform where providers have been vetted, and YouTube has ensured that we are actually licensed healthcare providers and that our channels are providing valid, safe health content, so you know that what you're seeing is a verified health source. So we are now a part of that, and that is very exciting. So you can, hopefully trust that what you're hearing is true. I hope this has really helped all of you guys so much. I really appreciate everything. And we look forward to talking to you guys again next week. I'm Dr. Samantha, the maternity mentor. Bye for now.